Erica.
They're always off time.
Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, August 19th at 8:31. First item is the approval of the consent agenda, which includes our meeting agenda, minutes, financial reports, abstracts and bills, service agreement with the University of Wisconsin Superior for a mobile crisis response needs assessment. Is there any changes to the agenda or any item a commissioner would like to pull from the consent? Commissioner White.
I would like to have further discussion for the public about the needs assessment or
Okay.
contract,
Well,
to have that at some point.
yeah, we'll put, let's see, we'll move item 2E down to, say, 4A, if that's okay for directors. We'll let Plamen handle that or hand it off. Any other changes? Then I would entertain a motion, please.
Mr. Chair, I'd like to make a motion to approve items A through D in our consent agenda.
I support.
Thank you. We have a motion and support. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Well, that moves us down to our staff report, and I'll pass it over to Plamen. Good morning, Plamen.
Good morning, Chair Mills. Good morning, commissioners and staff and others present. I'm going to be presenting the preliminary 2026 Public Health and Human Services budget. The Cook County Public Health and Human Services is an integrated agency with three main departments: social services, economic assistance, and public health. The budget was prepared in alignment with our agency mission and mandates. You should all have a copy of the detailed budget in your board packet. So please interrupt me and if you have any questions. I'm going to be going through the slides and pause it after each slide for questions. And I'll be multitasking, switching my computer slides with notes with the presentation. The 2026 Public Health and Human Services preliminary budget has a net county cost of $3,123,977, or an increase of 3.7% from the net county cost in 2025. This represents the difference between the budgeted expenditures and anticipated outside funding or the revenue. The 2026 levy request is 27.8% higher than an approved levy for 2025, and this is due to no use of fund balance in year 2026. As a reminder, $566,645 were used. Use of fund balance was budgeted in year 2025. Our proposed budget costs are 8.57% higher than last year, but with increased collections, mainly under the Social Services Department, our 2026 net county cost is budgeted 3.75% more than the net county cost of year 2025. Again, due to no use of fund balance, the requested levy is 27.8% higher than the approved one for 2025. The preliminary budget for year 2026 includes no additional full-time equivalents, reduction in hours for one public health educator from 40 hours a week to 20 hours a week, and reduction in hours for economic assistant case aid from 40 hours a week to 32 hours a week. Any questions so far? Next slide represents the organizational chart as of August of this year. We provide services, and it takes many educated and extremely dedicated staff to fulfill our stated mission Here's the PHHS staff organization chart as of August of this year. The Social Services Department, the 3 columns from the left. The Adult and Home and Community-Based Services Team supports the elderly, developmentally disabled, and vulnerable populations. The Children and Family Services Team includes work with child protection, parent support, and early prevention interventions. The Behavioral Health Team provides children and adult mental health case management, substance use disorder services, and crisis response. The Public Health Department, the 4th column from the left, who partner with several local agencies to keep us all safe, informed, and healthy. The Economic Assistance Department, the 5th column from the left, providing eligibility determination for financial and food support programs funded by the state and federal agencies, as well as health care programs. And the administrative team at the top, beginning with our director. And along the far right column is our administrative team supporting all 3 departments of the agency, including leadership, office support, and fiscal compliance. Yes.
Plamen, I'm sorry, if we can go back one slide to the budget? Yeah, I'm looking at the insert, which goes into a little bit more detail. I'm probably reading this wrong, but the first section, economic assistance, the way I read it, we're spending about $900,000 to give out about $300,000 in assistance, $900,000 administrative costs. Again, I'm sure I'm reading it wrong, but can you explain what's going on there?
I'm trying to follow the,
Okay, personnel, which I assume
Yep.
means administrative costs, salaries, is $900,000. And those personnel, their job is to give out $300,000 in economic assistance. Again, I'm sure I'm wrong,
yeah, I need to
but
see,
I need some kind of clarification.
I need to see the line item that you're looking at. I'm not able to see it on that.
The first 3 line items, this one, yeah.
Okay, this is the year-to-date.
No, this is year-to-date, this is the budget.
This is the 2025's year-to-date, though.
Okay, 2025.
Okay, let me look at it. I was on the budget for 2026, I apologize. Let me switch here to year-to-date. So, you're asking regarding the personnel expense in the budget for 2025, correct? So $897,000
That was-
of personnel expenses.
Yeah,
And on the collection side, we have $417,000 under the same line item. This is based on a federal administrative aid we receive from the federal government through the state of Minnesota.
okay,
And it's a percentage of the expenditures that we report through
Okay.
our quarterly reporting.
I wasn't questioning that.
Yeah,
I wasn't going across, I'm going down.
okay. And so the client programs, those client programs that are related to healthcare access, those are that are paid directly from our county and not from the state of Minnesota, okay?
Yeah,
Those include transportation, medical transportation, and cost-effective insurance,
okay,
okay? Those services are almost 100, they should be 100% reimbursable.
okay,
And it's only of the timing of when we receive the revenue
okay,
is that we might see some slight differences.
okay,
But the economic assistance teams administers many other programs that are not directly paid by the county itself, but instead, they are paid by the federal and the state funds,
okay.
once approved by our economic assistance team.
Okay, I
Okay.
get that, I'm not
Okay.
questioning the value of the services or the programs.
I'm sorry, I guess I'm not understanding the
What
question.
my question was, for every $1 in program, we're paying $3 in administration to administer that $1 in programs.
Right.
So-
If we could clarify specific, so we're on page 2 of
Packet.
the packet, thank you, of the 2026 PHHS budget, I believe, and you're looking at line item 6, I believe, correct?
No, I'm looking at the very first, under economic assistance, the very first line item, personnel.
It's line 6.
That's line 6.
Oh, that, okay, I don't have line numbers on mine.
Okay.
Okay, yes, 897,000.
Okay, and you're comparing that to which line?
So that's the cost, part of the cost of administering this program. And this program consists of giving out funds, totaling about $300,000.
And you're getting that from the lines,
So the next two lines added together, roughly, round numbers, $300,000.
the next two lines. Maybe we're on different pages here.
I believe
This
Mr.
one?
Storlie is looking at year-to-date for 2025 document,
Let's do this so you can see.
which is this item 2C, monthly report for 2025, July.
Mr. Chair.
Please.
So I think, frankly, I'm sorry, because you got multiple things there, but I think your question, basically your question, because there's a lot of data here, but is it, and when you look at it, you're just saying that if we invest this much money in this program to operate it, and this is what, we're distributing, the difference between what it cost us for what we're doing, how do we justify that? And that's the core question when you're looking at it.
Well, again, those are, the economic assistance team is doing mandated eligibility determination. And the expenses you see are expenses that are coming from the Cook County budget. They're related to cost-effective insurance and the the child support contract with Carlton County, which we also are required to provide. However, the economic assistance team determines eligibility for many programs that the funding is not coming directly from our local government. It's coming from Medicaid and from the state and other federal funds.
And Mr. Chair, I think overall, when we look at each department, but looking specifically now at Public Health, Human Services, and the umbrella of all of those different things that are reflected in the budget here, if we understand what is mandated as to what we are required to deliver by way of services, and we look at the funding sources that accompany those, and there are many mandates that are unfunded, and so then the county has to make a conscious decision as to how we're going to proceed, given the fact that it's all based upon levy or anything that we could generate in grants that is similarly related. I'll give an example that Milwaukee County, 80% of their budget is mandated. And if we look at in Wisconsin, if we look at our budget and understand departmentally, how many of our services are mandated? What is the funding source for that, and at what is the level that we want to fulfill that mandate that is going to be a burden that affects our levy? And I think that examination, I'll use that word, is a healthy discipline when we approach budget, is understanding mandate, what do we have to do, what do we choose to do based upon what we have financially, and the burden we want to put on taxpayers to deliver services at that level. And we're challenged, as every other entity, certainly in county government, with trying to provide more services based upon demand and expectation with fewer tax dollars. That is a challenge, but that is the fiscal stewardship that we're entrusted with as decision makers, and that's why wrestling with budgets, we need to demonstrate that we build that integrity into the process. So, but I think your question basically is just, gee, when I look at this, we're spending this much for this, and it's a return on investment, and how is that justified? And understanding that is part of that going through this process.
For the economic assistance team in question, all the programs that they administer are mandated and required.
Yeah.
And can I jump in?
Please.
And I think to your point, having some understanding about this line item and what what county-funded programs are included and what federally mandated programs are included may be helpful in the future as well.
Okay, and just for reference, for those who are having trouble following along, I'm not using the computerized spreadsheet. I'm looking at the paper handout. I printed out the attachments to the
Right.
agenda, and this is on page 15 of 41.
Thank you.
Page 15 of 41. And I was simply questioning, the upper left-hand corner under budget, the first three items. But that's as far as I think we can go with it this morning.
And I hear your point. I was just trying to follow with the numbers.
Yeah.
Yeah.
So that's what
And
the
I think,
numbers are, page 15 of 41.
yeah, thank you. And I think your point is well taken, and I think, Commissioner Gamble, you eloquently summarized kind of the meta too of what we're trying to do and figure out here too.
I think if we were in a, committee of the whole or whatever, but when we can have a discussion that helps us to understand, if you look at this under economic assistance and you say, what percentage of these things, and you understand what we're talking about on these things, because sometimes the umbrella language is not clear as to what's the nature of the service provided under that umbrella. But if we look at the service and we say, this is mandated by state, da-da-da-da-da-da-da, and the state has given us this percentage of revenues along with that mandate, or this is an unfunded mandate, and so in order for us to be able to provide this service by mandate at this level, it cost us this much money. And then we see, what are we getting for what are we spending, and what do we have by way of control and budgeting process to manage those dollars? So this is certainly a lot of detail, and I would just make an overall statement that where we are in the budget process, as well as where we are within public health human services, this is a challenging task, and it's this discussion is certainly in the context of understanding where we are, because we're coming alongside to partner in helping us to be able to deal with a very challenging thing. So this is by no means directed at individuals. It is saying, we've got this challenge before us, and we're going to do the best that we can to help staff but we need to be informed so that questions that come up like Frank asks, or any one of us, that we're clear in our response in affirming what you're doing.
Administrator Treble.
And if I may add, we are aware that there will be additional mandates into the next years ahead due to changes at the federal level. And so I think having some discussions at the Committee of the Whole during this board meeting as well about those changes may answer some of the questions that we've discussed here today as well.
Thank you. Thank you, Frank. Oh, Commissioner Sullivan.
And just for the listening public, when we're referencing page 15, that is the monthly report for 2025, not the budget that's on the screen that people may be watching for the 2026 budget.
Thank you. Okay. Thank you, Plamen. You said we could ask questions.
Absolutely.
You have to answer. On the next slide, this presents the 2026 budget impacts. Since we have people providing services, payroll always has the biggest impact on our budget. The 2026 personnel costs include 2.75% COLA increase and projected 10% increase in health insurance. Total of 19 positions were reclassified in year 2025. The director from grade 240 to 250. 4 economic assistance eligibility specialists from grade 150 to 160. 13 social workers from grade 170 to 180. 1 social services in-home support coordinator from grade 170 to 180. Staff turnover in various positions in 2025 is resulting in lower projected payroll costs, but also will likely result in increased training and travel costs. Client-related travel costs are higher than previous years, and these are required visits that are mandated by the state and the federal law. In the last several years, we received COVID-related grants in the public health and allocated ARPA funding to emergency response and recovery staff and services in public health. Those funds are no longer available. DHS has not finalized all funding allocations for 2026. Therefore, some anticipated revenues are budgeted using prior year averages. Some allocation amounts have been reduced. Like one example is the adult mental health TCM rates, while others have been increased. The children's mental health TCMs and the child welfare TCM. TCM stands for targeted case management. Those rates have seen an increase. The DHS Mobile Crisis Response Grant, that is a required service in the state of Minnesota by counties, and this is resulting in increased expenditures due to electronic health record implementation and contractor costs for clinical supervision and after-hour coverage, but that also is all reimbursable expense, and it's coming from the grant we have with Department of Human Services. So all expenditures are offset by that grant.
Mr. Chair.
Please.
Yeah. Plamen, when I look at the accompanying documents, and I look at this slide that you just went over here, and you have training and travel costs, and it defines it as required visits to clients who reside outside of the county. When I look at the documents and I see, like, under economic assistance, our staff training and travel is up 149%. And under social services, our staff training is up 133%. When I look at that as a line item, and I'm seeing staff training, we look at other departments, usually that means that it's continuing education, it's attending conventions, it's those kinds of things. I think it's confusing if under staff training, when the generic understanding of those line items means one thing, but your explanation says that it is actually visiting the clients. So I just want clarification on that, because when I look at that number in a year when we're trying to maintain budget, I would not like to see increases over 100% in the area of staff training and travel, which is normally understood to be continuing education and attending conventions. Does that make sense?
Yes, it does. It includes both. We do have some required trainings that staff needs to attend, but we also have an increased waiver load. We have people still coming in into waivers, being eligible for waivers, which requires our staff to do a monthly visit with those clients as a required requirement for the waiver to remain in place. So it includes both continuing education, includes travel to visit clients, but also includes training and travel for new staff too, which we anticipate we're likely to have this year.
Yeah. It'd be my recommendation that we break that out. It would be like out-of-home costs. When we look at out-of-home costs, which fluctuates considerably, that we understand that in the context of what that expense applies to. And in this case, if we have a line item that reflects how much we're spending because we need to travel to clients, that's one thing, and we can understand it in that context. When it comes to continuing education or conventions or whatever else that we might have, that should be a separate line item in my mind, because then we understand that clearly.
Commissioner Gamble, could you also, you mentioned the over 100%, just help me follow with which line that is.
Okay. If you look at under economic assistance, on page 18, page 18 is say under personnel, staff training and travel. If you look at,
So this is, I'm sorry to interrupt, this is under the financial report, is that right?
yeah, expenditures, page 18.
There's a little confusion because in our consent agenda, there's the monthly report, which I believe Frank
what-
was referencing. Is that also, or are you referencing the 2026 PHHS budget preliminary?
Well, I'm under the impression that this is the 2026 because it says
Okay, so
2025 budget. If you're looking at page 18, it'll have your figure for 2025 budget, and then it has the 2026 budget to the right in that column.
Okay.
So what we see is that staff training and travel line item in 2025 was $2,654, and it's projected to be $6,626, which is a 149% increase.
I'm following.
And so when you go to the one that would be on page 20, which is under social services, you will see that line item for staff travel is going from 36 to 85,000.
Thank you. Administrator Treble and then Commissioner Sullivan. Or Commissioner Sullivan, you had.
I
your
was
hand
just
very-
going,
Yeah.
I was just going to point out for the public that some of the confusion on page numbers is because there was an additional item E added. And so if you printed this out before it, the page numbers don't match.
That's just another little thing there.
At least we're talking apples to oranges here. Comment, please.
I would like to provide a clarification. The document you're seeing is a condensed version of my spreadsheet. So let's go back to economic assistance for a moment. I want to make it clear that for economic assistance, it does not include client-related travel. This is only based on one travel for a conference to 4 of the eligibility specialists so they can stay up to date once a year, while the supervisor remains and covers here.
So that's the 2,000.
When it comes to the social services side of things, when you're looking at the travel, client-related travel, that is, here, let's take a look for a moment here. The client-related travel remains fairly, it's the same number as last year. When you're looking at the $85,000 number, that includes the following. It includes travel for trainings and meetings for $22,651, and the electronic health record that is needed for the social services side, which is the caseworks, plus the expense for the electronic health record needed for a SUD program and the mobile crisis response. So between the two, that is combined of $62,000 a year. That $62,000 has nothing to do with the travel, but it has to do with the cost of the electronic health record and the data management software.
That's new.
That's helpful.
The increase
This year.
we see is the travel, training, and meetings. It's increase of 42%, and that is a 3-year average I've taken from years from the actuals for 2022, 2023, and 2024, with the mindset I leave that number higher like that because I knew that we having staff vacancies in many positions, and I felt comfortable that that is, while it's 42% higher than the last year's budget, it seemed appropriate to include because we have a lot of staff that's not, that a lot of positions that are open.
Administrator Treble.
So Plamen mentioned the two things I was going to mention, that we could separate out the program or client-related versus the non-client or program-related costs, which he just walked you through. And then I also just wanted to reiterate what Plamen said about the costs for travel for new staff and training. That will continue as we onboard new staff, because we need to be able to provide them the training to be successful in their positions. And so that's typical that you see those increases during a time where you have openings and significant staff turnover.
Thank you. Commissioner Gamble.
Yeah, and that would be understood because of our commitment to equip those that serve. So we want that training and thing. But I would say in your explanation, we would look at this figure and the $80-some thousand here and the difference. And then there are a lot of things that you referred to that I would just say normally, intuitively, when you look at that line item and how you defined it, you wouldn't find those under that. And I think that helping us to really understand the budget, it is best to break things out. If we find that we encounter something new that we haven't had in previous budgets, if it requires a new line item, I would recommend we do that as opposed to finding a place to park it. Because if it adds to confusion in understanding budget. So that's just an observation. I would rather see it broke out so that normal understanding of what that line item represents, that intuitively we can apply that understanding when we examine budgets.
Yeah, especially when it's 3 times more than the previous line item. When the new item is like so overwhelming a part of the old line item.
And I would just say as a generic statement overall when it comes to budgets, that the less the narrative, it's an indication of the better we've done in making sure that what we are representing is clearly understood. If budgets require a lot of narrative, then it means that it is more complicated. So I've always maintained that if we can make sure that our line items represent and are understood in a generic context what that term normally means, then people can understand it. If not, and they ask the questions, it's because then it requires a lot of narrative. And it's best if we can try to represent them in a way that intuitively understand them. And if it requires narrative, then link that narrative to explain why the difference.
Mr. Chair,
Please.
I would like to throw out a smidge of encouragement. When I go to AMC and attend the health committee meetings, we've talked about training for years. And we say when you have all new trainees, they can't always go to Duluth or Minneapolis or St. Paul. Please do things online. And I've encouraged AMC to support that. They're supporting us. Look at all the things, webinars and all the things that we can attend. So now we need to get it down to more of an employee type thing, which of course that would come from, the Health and Human Services Department as such. So in September, when we're in Alexandria, I'll go ahead and still keep saying, let's get this training so that people don't have to travel so far. And after 2 or 3 years, maybe they'll get and I don't know, has that improved any, where you don't have to do so much travel for new employees?
What I've seen is that after COVID, there was a big shift in online trainings, and now I'll take the state of Minnesota, for example, asking people to come back to work in person because it has a lot of negative impact on hotels, restaurants, and people are starting to realize that and starting to be in-person trainings, in-person seminars, webinars, not webinars, but because they're seeing that it has negative impact on their local community when they're not having people coming from the outside of the county and bringing money.
Interesting.
So I am all in favor of having, when there is an online version, to have that training completed online rather than in person, but that's not always an option.
There's always more to the story, I know.
Yeah, thank you. Commissioner Campbell?
Yeah, thank you, Mr. Chair. I appreciate that insight that you provided. What I would say that our focus is in training. I think that there is, and we have this discussion, I'm sure, as commissioners in a number of boards that we sit on about the personal being present. And when you're starting in a position new, that the training is one aspect of it, but the camaraderie and the interaction that comes from personal contact is hugely important. So I wouldn't discount that. But when I look at what our objective is, to equip the staff, I look at it in that context of the camaraderie, building relationships, and then it's like what I learn is enhanced because of the context or the venue or the environment that I find myself in. I would say that because the state is finding that there's a fall off in revenue from hotels and restaurants, that's the last thing I would be looking at.
Yeah, really.
Yeah, I wouldn't, my driver in decision-making and forcing people to do things would not be based upon loss of economic impact that affects here when it's affecting us locally as the taxpayer because it increases that budget. But missing the personal, when I evaluate how we want to equip our people, that's a huge element. So I wouldn't discount that.
Plamen, let's have a discussion offline, because my work at CDC for years had to do with training the state and local workforces. And there's a huge amount of resources. CDC trained, Public Health Foundation, Public Health Regional Training Centers, that offers all kinds of training, online and free. And some of it may be applicable to what especially your new employees need.
Thank you.
We can talk about that offline.
Thank you.
Each year, we thoughtfully budget for potential out-of-home placement cost. And while we're prudent with our budget, we cannot precisely forecast the needs of the community next year, nor how many children and adults may need temporary placement. In year 2025, the current year, the budget reflected a two-step approach to addressing these potential expenditures, increase the budgeted amounts for children out-of-home placement cost based on a 3-year average, decrease in the budgeted amount for adult mental health out-of-placement to return to 2-year average from 2021 to 2022, and contingency for using up to $200,000 of fund balance if needed in the social services for children's out-of-home placement, children's mental health services, and adult mental health placement. In year 2026, I propose no use of fund balance and increase the out-of-home placement based on a 3-year average, increase to the children's mental health placement to the 2024 actual amount, and increase the adult mental health expenditures from $50,000 to $100,000 to better reflect the increased adult mental health cost over the last 3 years. And when I'm saying that I'm proposing no use of fund balance, I'm going to switch to the next slide so I can explain.
Okay, thank you.
So actually, it's going to be the slide after that. But what this shows is that the levy, approved levy was reduced. The net county cost was reduced to the approved levy by $656,000 in year 2023, $566,000 in year 2024, another $566,000 in the current year. That's a total of $1.79 million use of fund balance, of budgeted use of fund balance over the last 2 years. Intentionally, we've reduced our fund balance because at some point was more than the budget for the following year. So we felt like rather than asking for levy money, we were comfortable reducing the impact to the levy by using fund balance. Now, in 2026, this next slide will show that the actual PHHS fund balance at the end of year 2024 was $3,309,216. But from that, there was some restricted funds that could only be used for certain reasons. So that left $3,282,072 available. In the year 2025, we budgeted $200,000 for out-of-home placements under the Social Services Department, and $366,645 under the Child Care Subsidies Program from wage enhancement. So the projected balance at the end of this year is $2,715,427. That is if all the revenues and all expenditures are exactly as we budgeted them. So, the county fiscal policy requires PHHS to have a fund balance of at least 42%. And that is because we don't receive our first tax allocation until usually May, which is the 5th month divided by 12. So when we consider that, we have to retain $2,580,753 of fund balance, which represents 42% of the budgeted expenditures for year 2026. That only leaves us with $134,675 of fund balance available to spend. It would be my recommendation to the board that we leave that balance and not use it in the year 2026. We have some changes coming from the federal and state government that we're still trying to determine. Grace Grenagar, our public health educator, will have a presentation in September during the joint Public Health and Human Services Advisory Council and a Mental Health Advisory Council meeting, in trying to provide some detail about those, what kind of impact those changes will have. My recommendation at this time is to not spend fund balance not budget for fund balance in year 2026, based on those numbers presented.
Commissioner Campbell.
Yeah. Thank you, Mr. Chair. I would say in looking at budgets that if we just take a family, that a family can see how shifts in their budget on the income and expense side, if they have increased insurance costs, if they have increased electrical costs, if they have increased whatever. And then you look at your income. If we, in our population, out of the 87 counties, have a population that is higher in retirees than any other of the 87 counties, 86 in the state, then our awareness is that depending upon how their shift in their Social Security benefit is, when they come to budget, they look at it and say, okay, here's my income. If I'm not getting any increase in Social Security, or it's very minimal, which has been consistently, and up until the last couple of years, that they have to make a decision to say, if we're going to continue to live life at the level that we live it at, we're going to have to dip into our savings, which is equivalent to our fund balance. So when we're looking at it, we have three options. Well, we look at multiple lines. One is our income. One is any increase in mandated services without funding, and that's the expense side of things. And the other is, what do we have in savings? And to the extent that we can protect our savings, if it's mandated that we need to be at 42% of budget, then we have no recourse. We just have to stay there. And your analysis here shows us that we have 130-some thousand over, but we're saying, given the uncertainty of things, we want to keep that there, which is the same as the family saying, we don't know what the rainy day is going to bring, so I'd hate to touch our savings here, but we're going to have to manage our income and expense. And so this is where I think the challenge is departmentally, is to try to be the best stewards we can in controlling costs so that we can maintain that 42% and yet not put that burden on the levy that impacts people that are struggling and maybe have tapped out their savings and can't keep 42% of it because of increased costs. So it's just a generic thing relative to budgeting, is we have these options. And if you want to protect the 42%, we can't do that on the backs of taxpayers unless we can demonstrate that we have no recourse, and that means managing budgets fiscally so that we don't add costs that become a burden to the people that have to fund this. I mean, I think we're all aware of that. It just, how do we get there? And that's through disciplines and through the course that I took on budgeting that matters, with NACO. This whole evidence-based, this data-driven, this community-driven thing, that is the partnership we want to create so that we all share this burden and responsibility and opportunity we have to deliver services at a level that we can afford, that is substantiated, backed up by the evidence of the process that we go through in arriving at our final figures. So,
Thank you. Administrator Treble.
Thank you for your comments, Commissioner, and I agree that I think we need to always be looking for ways to enhance operational efficiency and that we're managing the funds appropriately. I do need to add that I attended a webinar this last week about changes that will be coming from the federal government, and one of the things that they mentioned is this will have an increased cost for counties as we move forward. So I'm trying to make sure that we're gathering information about what those changes will look like for us, but I do want to make note that we will be asked to do more with less as we move forward. And so that's something that we need to be mindful of as well.
Thank you. Please.
And for the record, I take stewardship of funds as my number one priority. And the year of 2024 finished under budget because I have been very careful of how we spend money, and I've been providing regular summaries to our director, Alison McIntyre, at the time, of all the expenditures monthly and where the points of the increased expenditures were. And I have worked tirelessly with our fiscal team to improve revenues so we can offset the expenditures. Do we have a lot of work to do? I know that. I realize that, but it is not, we're trying really hard to increase revenues while we are really watching the expenditures carefully. So I want to make sure that that's clear.
Thank you.
thank you.
Yeah, and just additional context, if I may. Our previous use of fund balance for out-of-home placements as well as the childcare subsidy are both very intentional to spend down our fund balance, because rather than putting it on the levy, also the out-of-home placement is kind of our worst case scenario. So we really tried to invest in staff to get ahead of that. At least that was our attempt and our hope, and I think we've done a great job at doing that. However, costs have still fallen on us. And then as far as the childcare subsidy is concerned, there's a very similar tact there to try to really invest in our youth and our youngest. And that return is a much longer term return, but again, that was a strategy and intentional. But now when we knew the fund balance would not last forever, and that at some point we were going to have to shift, then here we are. So
It's still my goal to increase the fund balance to a comfortable level and continue to reduce the impact of the levy by using fund balance. And again, that will be only possible if we watch our expenditures and increase our revenues. And I'm well aware of that. So, and we're working hard with our team to towards that goal.
And bravo for the previous years, yeah.
Under revenues opportunities, we still continue to utilize the Substance Misuse and Suicide Prevention Grant, which is funding one full-time equivalent position. We also have other public health grants available to use, which are making impact to the community while offsetting staff and other costs. Those are Age-Friendly Communities Grant, cannabis education funding, the Public Health Emergency Preparedness and the CDC Infrastructure Grant, Response Sustainability Grant, Healthy Housing Grant, and the DHS Mobile Crisis Response Grant as well.
Commissioner Gamble?
Yeah, I just noted under the social services revenue, when you're referencing these revenues, that there's the mobile crisis response federal aid. And according to what I'm looking at, and I won't give the page number because who knows what it's going to be. It's, we're showing 11,000 in 2025 and we're projecting 351,000 for 2026, which is over a 3,000% increase. Can you explain?
That is related to the DHS Mobile Crisis Response Grant, offsetting staff costs and that increased personnel cost of $62,000 that we just went over about. That's the electronic health record too.
Yeah.
So
And part-
while we have an increased expenditures, we have a significant increase in revenue too. They're 100% reimbursable cost.
Yeah. Yeah, just looking at the numbers here, there's instances where we're seeing significant jumps in those revenues and understanding why that is. It's trying to balance what we see in the revenue side with the uncertainty on the, declining revenues. And I think when we have things that are not consistently, in other words, we can't anticipate that it's going to be a continuing revenue source, that spending those monies has to be intentional, as Commissioner Mills says, relative to if we establish new positions and things, it has to be tied to those revenues, and when those revenues goes, those positions go, because we can't build additional financial obligation ongoing with uncertain revenues in the future.
And I 100% agree with that. And we recently had a meeting with the County Attorney's Office and Human Resources Director, Grace Renaga and I, confirming that we will be reducing the hours of one of the public health educators for year 2026 because the funding has ended. And that we are in the future, when staff is being, when positions are advertised that are tied to grants, that should be clearly spelled in those job descriptions that those are tied to outside funding. And if the outside funding ends, it is likely for that position to either end or to be asked to complete other duties within the department. With regards to the Mobile Crisis Response Grant, we under contract through year 2026. So that funding is secured. Should we continue to provide those services, we have the ability to get reimbursed from the Mobile Crisis Response Grant from DHS.
Yeah, I applaud that. Huge. It's something we've talked about, and there are many county commissioners that we speak with that say that discipline in making sure, it builds integrity into our personnel and our policy as to how we publish and present a position so a person knows knowingly what they're getting into, and it's a recognition of our stewardship of dollars that we have, that we don't have, that we can't continue to fund that on the back of taxpayers once those funds go. So I really strongly applaud that.
On to the Child Care Provider Wage Subsidy Program. I'll be kind of going back and forward between the next two slides here, but I'm going to give you a little preview here. There was a board directive to develop program and funding support to address the local child care crisis in year 2022. $252,907 plan of use balance in 2023 for a child care wage subsidy program. $366,645 in both 2024 and 2025. The impact is a total of 197 spots available, served by licensed providers in Cook County and Grand Portage. There's a impact to the workforce and a business economic stabilization of our community. The 2026 budget includes no plan to use of fund balance. However, we would like to continue to support the local child care system, families, and economic health of the community. Just a reminder, I'm going to go into the next slide here and show you the numbers. As there is no plan to use a fund balance, this will have an impact on the taxpayer levy. And I'm going to explain here how I came up to the $253,751,000 wage subsidy program for this program. So first of all, I want to give kudos to Nancy, who's worked tirelessly to launch and continue to administer this program for our county. It's made a big impact to families and the entire community. So thank you, Nancy. So these numbers that you see here are the projected 2026 estimated FTE for staff, the hours, and estimated wage enhancement amount. As you can see, based on the projections Nancy has provided here, we are looking at a number of $323,000, $331,000 of wage subsidy in year 2026. Knowing that this number will have an impact to the levy, I looked at this number, I discussed with Nancy and Administrator Kristen, and we decided that we will take a different approach with this number, and I'll present the numbers to you, and ultimately this will be the commissioner's decision to what the total amount will be in the 2026's budget. But what I did is I took the actual amount of what we spent in year 2024, which was just completed, and from the $366,000 we budgeted, $224,000 was used, or about 61%. So then I said, okay, I can take that number and apply it to year 2026, I apologize. That number is $224,251. But then Nancy reminded me that there are two new providers here who are not there in 2024. So based on estimates, I took 61% of that expense and added it to the bottom line. And that's how I came up with $253,751. That is the number I have in the budget now, which is based on 61% of what we spent in 2024, and again, 61% of the two new providers, which is lesser than the $323,000 that is in Nancy's estimate. Again, as a placeholder, I've put the $253,000 and propose no use of fund balance, which this number will be funded by levy, because we don't have an outside funding to offset this expense.
So one thing I want to mention is, so you mentioned that 2 were added last year, and so with this number, just to be clear, that would mean no additional providers in 2026. Correct?
That there's Great Expectations program as well as Heights Phase 2 as potential 2026 additions.
So in addition to those 2, there would not be any addition? Just those 2 that you mentioned?
Not in our plan budget.
Okay.
And I was going to ask, the difference between previous budgets and the actual is significant. Do you see any other potential for growth with our current providers, or does it seem like we're kind of in our track, and that's
We are always working to help our providers
Right.
grow. And I think in these previous 3 years, when we've come to talk to you about child care wage enhancement, we always kind of look, and I align it with what I put in our D grant, that this is what our goal is. So we want to say, okay, let's get it approved for what our goal is in case we need to. The reality is things come and go throughout the year, right? And providers aren't going to get a new provider. So, which is good. We've always come in well under what we asked for. So I think that, what Plamen, looking at the last couple of years, we're going to average I think that is probably the very best way to go, especially if we're trying to go to our community and ask them to help support this out of tax dollars, not out of our savings account, right? So, so I really applaud and love this plan. I do think that, again, so my thought is, let's go with this lower amount, and as always, I'm going to always try to seek other funding. Other funding, how can we counter so that we are not having taxpayer dollars to do this? The challenge is in this field, it's hard to be able to find funding dollars that are going to fund wages over the long run, right? I have lots of dollars from the DEED grant, well, I think lots of dollars to help get programs started, to help programs expand, but to pay your people, yeah, that's not what we can use this for on an ongoing basis. But does that answer your question?
Yes.
Kind of, yeah.
Yep.
So right now, we are in the process of working with both of these, right, expectation and the heights in their second part. So that's why I felt pretty confident that those will come online in 2026. However, if they don't open until July, then there'll be half a year we didn't need to spend dollars, because we only spend those when we have actual providers providing actual care for kiddos.
Frank?
Two questions, one of them really brief. The wage enhancement comes out to roughly about $6 an hour?
It does. Yes,
Okay.
for 2025, we're at $6.11 per hour that we add to our
Okay.
child care providers.
Thank you. And Plamen's, the budget is based on the fact that last year, only 61% of the hours that were estimated were actually used and subsidized and paid for.
Correct.
What happens if there's a higher utilization? In other words, more spots are filled, which means more healthcare, childcare hours. Where does that come from? Does that go back now to the reserve fund?
It's a good question. My understanding is I see that as a not to exceed amount. But if we receive guidance from the board that if we exceed that amount, then we can dip into our fund balance, that's fine. It leaves us with $134,000 still available of fund balance. And I would like to preserve those, but ultimately that's not going to be my decision to make.
Sure, thank you.
Commissioner
And if I
Gamble?
may add to, Commissioner, my thoughts as I think about this is if we get close to that number, there are ways that we originally came out kind of with a more reserved program, because we weren't sure how all the funding was going to work, right, in the first year. So we, in that, for instance, we did not pay for any hours that were over 40 in a week. We did not pay for outside, like, administrative work that you have to do to make your program work. Those hours we couldn't include. They had to only be actual hours children were in care and not more than 40. Although providers work like 55 or 60 if that's their program. So my thought is, if we're going to get close, if like in June, I think we're going to be exceeding, then we may have to put some of those rules back in place, just to be able to stay where we need to be. Like Plamen shared that this is our not to exceed amount. So we may have to put some of those. We've been fortunate that we've been able to fund all the hours that they really are working, but they know that the state does not do that in their subsidy that they provide. So we may have to scale it back. I would much rather scale it back than to say, yeah, too bad, we're all done. We can't do that at all. But again, those are the choices that you guys make as commissioners and what you value for your constituents that you represent.
And this is kind of a weird hope, but I hope that we run into that problem. Because then we have more providers and more, more child care. Commissioner Gamble, you had.
Yeah, thank you. So just so it's clear for the public too, this is to enhance wage, so we enhance at the rate of $6 per hour. So it's not that the employee's getting $6 an hour, we just supplement the wage they're getting with the $6. The other question I would have is this a discretionary expense or is this mandated?
It's us. Yep.
I believe it's discretionary.
Yep.
It's completely
It's all us.
discretionary.
This was based on a DHS program that started during COVID and then ended, and we continued basically in that structure.
And initially, it was funded with COVID dollars?
Correct. Yeah. I think it's always been fund balance.
It's always been fund balance
Yeah,
in
Okay.
the last
yeah.
3 years, yeah.
All right.
Except for when the state was doing it, of course.
Okay. And this is something I'm sure we're aware of as well, but when we look at something and it's a discretionary decision, we say this matters to us and important to us, therefore we're willing to take fund balance. But we need to, at that point of that commitment, be looking at how we're going to fund this moving forward, because fund balance won't always be there.
I included a slide from the presentation that Nancy did at the Committee of the Whole in July to kind of reiterate the importance of the program, and that there is still a need for about 98 more childcare spots, and the cost of care for providers is high for younger age groups, and that the average cost of care for families is $226 per week per child.
It would be interesting to juxtapose that with the cost per household in the county. Just what does it cost every household in the county to provide, the subsidy versus the cost for,
It'd be simply dividing
Yeah.
the 253,000 by the number of households.
and then, just versus what every family is paying per week. It's just interesting numbers there.
Next, on our discretionary funds, we have the Public Health Fund recommendations for year 2026. The Community Health Assessment and a Health Improvement Plan identified goals to ensure local resources are targeted towards the greatest needs in the community. The Public Health Grant Fund program allows us to partner with local providers to meet gaps in these community services. For year 2026, we received applications totaling $282,000. I have included in the budget $150,000 in funding, and this is a decrease of $40,000 from year 2025, but returning to the amount in 2024. Again, this is funds that are not offset by outside revenue, and these will be supported by levy, so this will have impact to the levy.
Please, Frank.
Again, sorry. I have some comments about this from the advisory council. And I can mention them here or later in the advisory council report.
Let's do it later. Thank you, just in case. I have a feeling we got a little ways to go, or unless the board, how does the board feel? Would you like to hear more now, more detail?
I would just say if it's relevant, while the mind is on it,
Okay,
I think it'd be better to input it now.
okay. Thank
Okay.
you, Frank. Please go ahead.
The most important thing is you'll get our official recommendations for next year's allocations and grant recipients at your next month's meeting. Okay. In the interim, I would like to say that although we allocated $190,000 last year, this year we went on the assumption that that would be reduced by about 25%. So again, the total grant allocations which would be recommended would total $150,000. I would also draw your attention to the Cook County Council on Aging. As you can see, they requested $109,798. They are a grant recipient for next year, but at a much reduced rate. This does not imply at all, and this is something that the council wanted me to emphasize, this does not denigrate the value of the services that is offered by the Council on Aging. Just the opposite, that these are considered essential services. And as essential services, should not be dependent on these discretionary funds, but should rather be a line item, and I don't know the financing and budgeting details of how that's done and what the relationship would be, but this should be a decision that the board makes to support the Council on Aging's provision of essential services to the Cook County population. That's what I wanted to
Thank you.
emphasize there in your budget deliberations. And as Commissioner Gamble said, yes, you have to balance what we'd like to do versus how is it going to be paid for. And that's the Commission's deciding job. So thank you.
Thank you. Thank you for your work on that, too. Okay.
And again, this is the 2026 Public Health and Human Services preliminary budget. I'm sure we'll be making changes to it in the coming days, but that's the information we have available as of now. Again, no use of fund balance as proposed.
And, just for perspective, as presented, it's roughly, very roughly, about 7% levy increase overall. Big levy, not PHHS.
3.75% for PHHS, if you take the fund balance into consideration.
I'm sorry, can you say that again?
So the net county cost is increasing by 3.75%. But because we don't have any use of fund balance,
Right,
it
yes.
skews the numbers and it looks
Yeah.
like we're asking for a big increase of the levy. which-
Oh, yeah, no, not on you, yeah, it's purely because of the not use of fund balance. Commissioner Gamble.
Yeah, thank you. Yeah, it's a huge undertaking, Public Health Human Services, huge. The other thing that influences this is because it is such an emotional thing related to the well-being of the people in our community. So when you take the emotion and you take the complication and you take the other part of it, which is the mandates and things like that, it gets unwieldy, which speaks to staff that invest themselves in trying to look at the detail, be as good stewards as you can, which is hugely important. It's important because we need to balance what we do, what we have to be able to fund this, and building the trust relation with the public in an area that is so emotional. But when I look at it, and I'd say in this year, if we came in and we said, we need to stay at where we're at, or we need to reduce it because we see a reduction that's coming from all of our funding sources, whether it's on the federal level, whether it's payment in lieu of taxes, whatever it might be. Those are realities that we have to deal with, and that's what is challenging, but it's an opportunity for us to build that trust and demonstrate our fiscal responsibility. So when we look at this in the context of 3.75, if we said it needs to be flat, no 3.75% increase, then we do what we have to do. And I go back to Milwaukee County again. If 80% of everything's mandated, what do? If those costs are going up and we're not getting revenue, we're stuck. It's a real challenge. But the point is that because we aren't using fund balance or the family isn't taking from their savings this year, then we're stuck with a 27.8% increase. And in this year, looking at the budgeting process, 27.8% increase is not acceptable. When you say that, I say it in the context of the empathy for all of the things that I previously mentioned. But the point is that, boy, that's tough. And we can say, well, it's because we can't take from our savings. And we've used that to try to mitigate the impact on the taxpayer, but we don't have that opportunity, and that's a reality that we constantly discuss when it comes to fund balance. But I would just encourage looking at this. The 3.75 doesn't look so bad, but it'd be best if we could try to bring that down in view of the fact that we're not going to be using fund balance, which then brings it to a 27.8% increase, which is, in this environment, pretty wieldy.
Mr. Chair.
Commissioner Storlie.
Plamen, could you go back to the previous slide? PowerPoint, before that, another one. There. Could I get a copy, or all of us get a copy? Because this is a lot to consider, especially in the light of the fact that there's been discussed that perhaps we would do the Council on Aging. So I think I would appreciate just this, so we can put it into our mix of everything to remember what all this was already considered. I'd appreciate it.
And again, this does not include recommendations for 26.
Right.
You'll be getting that next month.
The slides will be attached to the minutes.
Great.
It'll be attached to the minutes, yeah.
And if you would like a copy before we leave today, I can have Jana make copies.
I would like a copy before the minutes, because that's a month away. Okay? Thank you. Thanks, Plamen.
Commissioner White.
I also would like a copy before the minutes.
Okay, thank you. Thank you, Plamen, for that report. As Commissioner Gamble said, not an easy task here. This moves us on to Director's Report, staff updates. We have our org chart. And again, I'll pass it over to Plamen.
Most of the updates I have are on, from the public health team. August and September events that involve the public health team. Support at the Fisherman's Picnic Table, including providing a lactation tent for families. Christina Madsen will be presenting at the August 20th meeting of the Arrowhead Birth Collective at Cook County Higher Ed on lactation at 6 p.m. The public health team will have a presence on the afternoon of Friday, September 9th, at an educational tent which will feature information about 988 phone line, prevention, harm reduction, and other public health topics. The mobile crisis response service is active, with Andrea Ores continuing to serve in our class appointment, both to respond and to support program administration. I want to make sure I acknowledge Andrea for all the work she's been doing. Thank you. The public health vending machine has arrived and has been placed in storage for now, with plans to conduct additional community engagement this winter prior to installing the machine in the community. Speaking of cannabis, regional communications campaign is active this week, with both digital and print-based ads to be placed across the 4-county Arrowhead region. This campaign is targeted at parents, caregivers, and other adults to empower them to educate themselves regarding the health impacts of cannabis, and to have honest conversation with the young people in their lives about cannabis. The Food Access Council has its first 7 voting members. An action group continues to work with the local food shelf to explore the super shelf model, as well as ways to support more generally. The council is also starting a multi-part conversation about food insecurity among youth, hosting a series of guest speakers who work with youth and families around food access. Christina Madsen, in her work with the Safe Routes to School, is supporting GES to provide parent education materials regarding the drop-off and pickup areas, and as they prepare for the school year to begin. Andrea Tofty is preparing for the September National Preparedness Month initiative to engage local businesses in educating the community on how to prepare go bags, currently reaching out to business partners to gauge interest. Grace Grenagher has continued to work with Care Partners, North Shore Health and North Shore Healthcare Foundation, and the South Mountain Clinic to develop the vision for resource directory website. They have reviewed contractors following an RFP process, request for proposal, and initiated communications with the vendor who the group agreed most closely aligned with the needs and the vision of the project. The goal is to bring a contract for this grant-funded project before a board at future meetings, hopefully in September. Grace is preparing a September presentation, as I mentioned earlier, for both our PHHS and local mental health advisory councils on how federal budget changes may impact local PHHS service provisions. This is a topic that she would be happy to present to the PHHS board at a future date as well.
Thank you. I failed to consider our additional item here, item E, from our consent agenda, and that was supposed to be addressed first, so my apologies there, but could we go back to that? And Commissioner White, you wanted to go into a little more detail there.
Well, I would just like, for the public's sake, to have it explained in a very concise way, what we're doing as a county and why with the, this is to approve a service agreement with the University of Wisconsin Superior for mobile crisis response needs assessment. And perhaps Plamen can best iterate the goals of this and how it will be helpful for our community.
Actually, I'm gonna ask Andrea to provide an update because Andrea has been working on the mobile crisis response to administer and to respond.
And I would suggest that maybe having a microphone brought over for Andrea would be helpful, just so the public can hear clearly.
That makes sense.
Good morning, thank you.
Morning.
So the needs assessment is written into the deliverables of the startup grant that we have for mobile crisis response. And I was not part of the beginning conversations, but what I have determined is that the needs assessment would outline potential other mobile crisis response options that we might have as we move forward with the process, keeping in mind, similar to the conversation that you had earlier about the cost of providing a service versus the service need. Because our call volume in Cook County is so low, and it is a statutorily required service that has to be provided, the needs assessment will help us in collaboration with North Shore Health, Sawtooth Mountain Clinic, Grand Portage Human Services, HDC, and the Arrowhead Behavioral Health Alliance to determine what other potential mobile crisis response models exist that we might be able to utilize in the future, with the potential that, you know, grant funding might not always be available to offset the cost.
If I may add, that cost for this contract is fully covered by the mobile crisis grant, so there will be zero impact to the levy. That just wanted to make sure that's clear.
Thank you, Administrator Tremble.
And if I can add as well, I was very pleased to see this proposal and this project overview provided for the crisis response team, because this really allows us to have the data to be able to determine the best path forward. And so I just wanted to mention that this proposal was very well done. The cost is incredibly reasonable. In my past role prior to coming here, I was a consultant supervising a team that did work like this, and this is very, very well done.
All right. Any other,
No.
okay.
Thank you.
And so, yes, Commissioner Sullivan.
So I'd like to make a motion to request that we approve the service agreement for UW Superior's Center for Research and Evaluation Services to provide mobile crisis response needs assessment.
Thank Commissioner
I'll
Selton.
support.
Thank you, Commissioner White. Any further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. Okay. And anything else under your director's report, Plamen? Okay. Thank you. That moves us down to items for board action, which is very quick today, nothing there. And that moves us down to our committee reports. And we'll start with the Active Living Steering Committee. Commissioner White.
Many, many items, but the one to really to know about is that starting now in this coming year, they're going to do a very comprehensive assessment and then brainstorming on how to move pedestrian and bicycle, non-motorized travel safely from GES around the Gunflint, past the apartments, and then down the street, trying to minimize fatalities.
Good.
So
There's that trail going, right? Multi-use,
Yes,
okay.
yes, that's it, but they wanted to make certain that they get it all right to start with.
It's also good. Thank you. Next one is the Arrowhead Economic Opportunity Agency, Commissioner White.
It meets tomorrow.
And I imagine they're having some challenging discussions as
Yes.
well. Yeah. Arrowhead Health Alliance, any updates there?
Nope, they did
Okay.
not meet this month.
Okay. And then ARC, Arrowhead Regional Corrections, Commissioner Gamble.
Yeah, thank you, Mr. Chair. This is minutes from our July 18th meeting, and then we did have a subsequent meeting that Commissioner White and I attended as well. They reviewed the preliminary budget. It's a challenging year for budgeting, which we are all familiar with. One of the big drivers affecting the budget is health insurance, and it's projected to be 10%. It could be as much as 20%. In this last meeting, they settled on the 10%, but they did say it could jump. Cook County's contribution to ARC for 2026, according to the preliminary budget, is $211,583. So we have Cook County, Carleton County, St. Louis County, Coochin County, and we are in Lake County, and we're all in this joint group through the Arrowhead Regional Corrections Board. And when we look at our contributions as counties to support NERC, this $211,583 that is projected for 2026 budget is 51%, a reduction of 51% over our 2025. So it's about a half of what we've been paying. And if you want to look at that, that's $131,000 from our 2023 contribution. In other words, it's reduced to $131,000. And if you look from 2017 through 2023, a period of 7 years, our contribution averaged over $300,000. So we're down about $100,000. It is based on our participation. That means if we're sending individuals, if you look at the statistics relative to admissions to NERC since 2008, during this period, the highest occupancy that Cook County had was in 2010, where we had 10 individuals. Since 2016, the number of individuals admitted has been 6 or under, and 2024, as Commissioner White had referred to in a previous meeting, we reported no individuals admitted from Cook County. Commissioner White and I had a discussion about that with the director in this last meeting, and trying to understand that. And that's something I think that needs to be looked at. If we have this partnership, are we using it to the extent that we should be using? And I'll comment more on that. Here's some of the comments that come from individuals who have participated in NERC. The individuals writing after they've been in the program, they say, a better person and staying sober. I got my sobriety, I got good advice, and I felt like I gained knowledge about my decision-making. I remembered who I am. I learned how to identify my emotions. I got a parenting certificate, learned about housing and other stuff. I also got my GEDD. Time to reflect, got my life back. To reinforce that, according to a December 2024 Minnesota Regional County Jails Consolidation or Merger Study conducted by the Minnesota Department of Corrections, as commissioned by the 2023 Minnesota Legislature, the Northeast Regional Corrections Center, NERC, was recognized as a model facility. Rather than functioning as the primary detention facility for Carleton, Cook, St. Louis, Koochiching, and Lake counties, each of which maintains its own jail, NERC provides specialized programmed-based options. This hybrid approach allows participating counties to maintain local control while assessing shared resources for specific inmate populations, particularly those who might benefit from specialized programming. This model illustrates the potential flexibility of regional cooperation, demonstrating that collaboration need not require complete consolidation of all correctional operations. So basically, when you take the comments and you take this recognition that has come by this consolidation merger study, we have a very, very good facility that models programming that is very human and relational, and you can see by the outcome of the participants that it is a good program. During my first term as commissioner and attending the MACAC conference, which is the correctional in the state, that we've often looked at our programming approach, and Minnesota has a good program, and NERC has a superior program when it comes to how we deal with offense and trying to restore individuals. And the next meeting for NERC in September, which will be the 19th, we will be meeting at the new city conference. And I'd like to invite you to attend so you can meet the folks there. They're eager to meet you, and certainly anybody that would like to attend that September 19th meeting, they meet at 10 o'clock. But I'll have Jenna send out a notice too, as a reminder.
Thank you. Commissioner White?
And I want to reiterate, as last time, the obvious care and teamwork of all the individuals at NERC is astounding. And I believe that is why they are so successful. Anybody there can do just about anything that anybody that is staying there needs. It's not just lockup. It is educational, it is counseling, social help, and it's an astounding thing to be able, and they actually said it out loud, that they were a team, they worked at a team at this last meeting, but I could sense that from the other meetings, that this is a well-oiled group that cares, and that is what people in trouble need, so.
It's evident it's not just a job.
Oh,
Yeah.
definitely.
Yeah.
Wonderful, thank you. The next committee report would be the Child Care Solutions Subcommittee. Commissioner
We
Storlie?
have not met, but I think we all remember the great presentation that Nancy gave us at the Committee of the Whole.
Yeah.
So I'll let that stand as a report.
Yeah. Thank you. Community Health Board, we did meet. Again, difficult discussions there. There was another grant received in an effort to go after food security as well. I cannot recall what the doctor reported on, but Frank, do you want to add comments there?
Yeah, well, the food grant was the Climate Smart Food Systems Grant. And it's not food grant per se, it's like the intersection between climate change and food security and sustainability. And we are participating in that along with the other four. Dr. Kufal talked about the health hazards to do with smoke inhalation.
Wildfire.
From wildfires, et cetera. And pointed out that, not to throw too many numbers, a tiny increase in the particulate matter in the air can lead to a 1 to 2.5% increase in overall mortality. In other words, number of deaths, even from a relatively small amount, particularly the very young, very old, and those with respiratory problems. So, if it's bad out, don't do the things that are going to increase your respiratory rates. Not the best time to go jogging. If you have to be outside to work or something, break out those old N95 or KN95 masks. That's what they're for. They're particulate masks for things like smoke.
Thank you. Next one is the Mental Health Advisory Council. Rana?
We did not meet.
Next committee report would be the Cook County Restorative Justice, Commissioner Gamble.
Summer hiatus.
Very good. And next one is the Council on Aging, Commissioner White. Any update there?
No, humming along and seeking money, and
Yep.
and as I reported last time, they had 1,000 people sign in to their space using, and it wasn't just to eat, it was using the different services that were offered through there,
Yep.
so.
Significant, thank you. Emergency Preparedness Committee, Commissioner Sullivan.
Thank you. So we had a meeting recently and had an excellent turnout. Relatively new participants, WTIP was there, the Red Cross was there, Grand Portage participated, many of our partners. And we had a new representation from the West End, Kathy Johnson, so we're really happy to have her join us as well. And we went through cybersecurity discussions, which were quite timely, and talked about various questions like, does the various organizations participating have response plans, or do they have policies around it? So the school district, the hospital talked a little bit about some of their cybersecurity incidents, how they responded. And we talked about communication within organizations during those events and also between partners, and shared gaps and vulnerabilities, but it was, again, very timely, and was really excited to see that we looked at this. We always talk about weather events and fire, and this is, something that in this day and age is just happening everywhere to everyone. So I really appreciated the discussion.
Thank you. Next committee report would be the Healthcare Planning Committee, Commissioner Storlie.
We have not met.
Okay, and then there's NACO.
Then there's NACO. We'll have a discussion the first week of September, just reviewing all of the different items that was brought before the NACO conference in Philadelphia, and try to sort out some of the important things to maybe dwell on and discuss over the next few months.
Thank you. Northeast Minnesota Office of Job Training, Commissioner Gamble.
Yeah, another summer
Okay.
hiatus. We will be meeting in September, though.
Okay.
I've got confirmation that September will happen because we figure the summer will be gone, so.
Yeah. Things will calm down. North Shore Collaborative, we have not yet met. Just got a request for updates. So we'll be meeting, I'll have a report for our next meeting. And then the PHHS Advisory Council. Frank, anything additional you wanted to add there?
No, just that the council as a whole did not meet. The only activity was with regard to the Public Health Fund.
And Cook County Food Access Council, Plamen reported on. I actually missed that meeting again. But yep, seven-member council is formed, established, and that would kind of a large part of the previous meetings. Relatedly, though, I was able to attend the Northwoods Food Project, which is focused more towards growers, farmers, and one kind of fun thing there is the library of equipment for food processing. So if you want to spread that word out, it's quite a resource. If one person tries to own all of the equipment, you use it every now and then or whatever, so having a shared resource makes a lot of sense to be able to do canning or dehydrating or however you want to prepare food. So pretty excited about that. Also, finally got a chance to meet their director and that's very exciting. A lot of energy there and focus and drive, and so it's a new chapter, I'd say, for that group. Again, that's a grant-funded position, so looking for funds and understanding that that was actually part of the job, was to also look for funds.
Look for grants.
But, yeah, but yeah, it's been great thus far. Anything else for the good of the order from anyone? Please, Frank.
Yeah, Commissioner, back to the Food Access Council.
Yes.
Has word gone out about how you can donate equipment?
The Northwoods Food Project?
Mm-hmm. Yeah, the library, the equipment library you mentioned. How do you
Donate to it?
Yeah.
No, I don't think, so they have the equipment, and now it's ready to be, I don't know if they're looking for more equipment.
I believe they are. 'Cause
Okay.
that was a discussion that came up during the grant stuff. Or that's okay, I'll
Okay.
contact them directly about how to donate equipment to it.
Okay, thank you, yeah. Commissioner Gamble?
I wonder how that parallels with the University of Minnesota Extension, because the equipment that they're talking
The use
about
of the
that
kitchen
program.
there, the use of the kitchen?
Yeah, Sarah Waddle is on the Northwoods Food Project board, so.
Yeah, so I think they must be the same program that we're talking about, because basically
Probably.
it's
there, yeah. It's at the community center.
Yeah. Okay, because we're
Okay.
talking about
I'll talk to
that.
Sarah about it.
And if your comment was about, are they taking donations if you have something you want to give them? I assume that they would if it's something that's in condition
Yeah,
and
of
something
course.
that they need, yeah.
Yeah, okay.
Yeah. But I
Thank you.
think it's great, the program, so that people have that without having to invest.
Absolutely.
And then it gives them a chance to find out if they want to move forward, and so
And
that's,
they'll be doing demonstrations as well. I think there's going to be kind of a potluck and then a cider pressing and then at the farmers markets as well, which is quite the event. I think there's hope to kind of give some little demos there, or at least show what can be done. Maybe not do it right there and then, but yeah. There was something else related to that, Commissioner, but oh well. Okay. Anything else for the good of the order?
I just have,
Commissioner Trimble.
thank you. One thing to add, I know Plamen had walked through our organizational chart for PHHS. We do have a number of vacancies, and so we are looking at filling some of those, at the same time also looking at the organizational structure for the department and operational efficiencies as we move forward.
Thank you. Commissioner Gamble?
yeah, thank you. I just would make a comment to that any time that there is change, it gives us an opportunity to step back and evaluate, and certainly this is something in making comments which I did today relative to departmentally assessing what is mandated and what we choose from a discretionary standpoint to include in the services that we provide, looking at that in the context of the revenue that we have. I would just encourage relative to public health human service that evaluation, we have that opportunity, let's do that, and evaluate it in that context of what is mandated and what we need to do. Thank you.
Thank you. All right, hearing no other comments for the good of the order, let me bring this to adjournment, and we are adjourned. Thank you.
I have my list.
do that.
It's going to take some time, but all of your questions were good questions.
Yeah, I kind of got out of that.
It's like, I have some time, but it's
And you keep things.